Another important factor with decay is diet. So just like the acid that the bacteria makes, the food and drinks that we eat and drink are acidic. And so the mouth, this is the pH scale here, and the mouth is happiest at a 7, and that's where it's neutral. And our enamel will begin to break down at about a 5.5. So you can imagine what all of these sodas and energy drinks that are here on the 3 are doing to our enamel. That's putting us really a susceptible risk to decay. So, just encouraging your residents, they can have these drinks, of course, we don't want to take away everything, but just encourage them not to sip it all day, because then that's creating the acidic environment all day. So if they do drink it, encourage them to drink it in one sitting and then be done with it. And then if they need to sip on something all day, then encourage it to be water. So dry mouth is actually a side effect of medications. A lot of residents take quite a few medications, and there's over 400 that cause dry mouth. Also, if they've undergone any chemotherapy or radiation, that can contribute to dry mouth, or if they have an autoimmune disorder. So just some things to be aware of. So why it's important for us to know if they have dry mouth is because we really need saliva to have a healthy mouth. Saliva is actually a natural cleanser, and it'll neutralize those acids that we talked about with the bacteria. It'll actually bring the pH back up. We need it to speak, swallow, even taste. If we don't have enough saliva, we can't taste our food properly. And to speak, we need it to speak too. So it's a really important protective factor to have against that decay in the mouth. So some products before I get into that, some signs to look out for in their mouth. If you'll notice the gums, they look really shiny, and that's a side effect of dry mouth. You can see this is under the tongue, how shiny that looks. And then the tongue as well, looking at the tongue, if it looks like it has cracks or fissures, that's a sign of dry mouth. They may complain that their tongue burns too, and that's caused by dry mouth. So with that, we want to give them saliva substitutes. Just to stimulate that saliva. It's really uncomfortable to have a dry mouth all day, so we want to make sure that we're giving them these products. It makes them more comfortable, and it's giving them all those good protective factors that we need from saliva. So there's so many different products for dry mouth. A common one is the Biotin rinse that we can give them. There's also lozenges, gels, sugar-free candies. We want to make sure that they're not sucking on like a lemon head or a cough drop all day, because it's the same thing. It's full of sugar, and that's creating that acid in their mouth. So another great product to use is xylitol, and it's a sugar alcohol. And the bacteria that makes decay can't eat the xylitol. So you're actually fighting against decay and helping with their dry mouth. So. And I did bring you guys some sugar-free Werthers to try. I know some people don't like the idea of sugar-free candy, but honestly, I can't tell the difference between sugar-free and a regular Werther. So if you guys want to try that, it's a good substitute to have, especially if they're wanting a sugary candy to suck on all day. Make sure it's sugar-free or has xylitol. I will say though that xylitol cannot be eaten by animals. It's toxic to animals, so especially with this cute dog, just make sure that they can't get into the xylitol.